Good afternoon, everyone. Thank you for joining us today. We will be starting very soon. We're still waiting for others to join. So just give us a few moments. I'm glad you are able to join us today. People are still joining. Give it a few more seconds, and I think we can start. Oh, let me see. Yes, I think we can start. Okay, so hello, everyone, and welcome. My name is Lucia Leone. I'm the Senior Benefits Manager, and I am joined today by members of the CU Benefits team, my colleagues, Angela Chen, our Assistant Director of Benefits, Pete McHugh, Director of Communications, Jose Feliciano, Manager for the Benefit Service Center, Nicole Smoot, Manager for Tuition, Maria Matos, our Senior Benefits Analyst, and Lauren McRagone, Assistant Director for Benefits Operations. So today's session is designed to assist you with making the best choices, benefit choices for 2026 for yourself and your family. We will provide information about where you can obtain resources during open enrollment, important contact information, and highlight the new benefit offerings. If you have any questions during the presentation, please use the chat feature and submit your questions. We will answer your questions during the Q&A session at the end of the presentation, and we will also answer them in the chat during the presentation. Next, please. So when is open enrollment? I think some of you have already received your package, your open enrollment package. Open enrollment begins on Monday, November 10th, and will end Friday, November 21st. If you have not received your brochure yet, the open enrollment materials include the brochure. If you have not received them, you can go on to our humanresources.columbia.edu/OE to link to your brochure. You could also call the Columbia Benefit Service Center, which is a great resource. We are available Monday through Friday, 9 to 5. So please call us at 212-851-7000, or you can email us at hrbenefits@columbia.edu. So where are you enrolling? You are enrolling in CUBES in the Columbia University Benefits Enrollment System. If you've noticed, you may have been in CUBES. You may have noticed the new look and feel of CUBES. We have updated it a little bit. So you'll see that it's a little different than what you're used to if you haven't seen it yet. While in CUBES, we would like to ask you to please consider opting for the electronic document delivery of legally required notifications. And please remember that the changes that you're making during open enrollment are effective for the entire year of January. It's effective January 1st, 2026, and will be and remain effective until the end of the calendar year. That is, unless you have a qualified life status change, which is if you get married or if you have a child, that's considered a qualified life status change in which you can make changes to your benefits. Next, please. So as in previous years, we offer a passive open enrollment. This means that you're not required to make any changes to your 2025 benefits. The benefits that you currently have, if you do not make any changes, will roll over to the following year. There are exceptions to this, and as you can see, if you do not enroll, if you are enrolled in the healthcare flexible spending accounts, the dependent care flexible spending account, child care benefit if applicable, you would need to re-enroll in those benefits. They essentially, your contributions or election essentially end at the end of the year. So make sure that you go into cubes to make those, to re-elect those for those accounts. Voluntary benefits, if you'd like to enroll in voluntary benefits, you would also, for the voluntary benefits on the screen, please be sure to enroll during open enrollment. Next, please. So now we'll go over what's new for 2026. Life insurance. So life insurance can help you provide financial protection for your loved ones in form of a lump sum benefit to your designated beneficiaries in the event of your death. Currently, eligible employees, you are now covered at 1 times your annual salary up to $50,000 at no cost. You also have the option to elect optional life insurance, but it requires evidence of insurability. However, during open enrollment, during only this open enrollment, you have a special opportunity to enroll or increase existing life insurance coverage up to 3 times your annual salary, up to $500,000 without evidence of insurability, without showing evidence of good health. And in addition to that, there would be a reduced rates for both optional life insurance and accident, death, and dismemberment insurance. We also wanted to take this time to remind you about your beneficiary designations for life insurance. To be sure your beneficiaries are in place, we encourage you to review your beneficiaries for life insurance housed in cubes. So the next one is retirement. Is that the next one? Yeah. The next one is retirement. It's Secure Act 2.0. There's an important retirement plan update. So if you are turning age 50 anytime during 2026, you have at least and have earned at least $145,000 by December 31st, 2025, and want to make catch-up contributions to the voluntary retirement savings account, the contributions must be made at a Roth post-tax basis. You can no longer make contributions pre-tax basis. Voluntary benefits. So there is a change to the voluntary benefit carrier for accident specified disease, formerly known as critical illness, and hospital indemnity. The current carrier is MetLife, and it's going to change as of the beginning of the year of 2026, transfer over to New York Life. So if you've already enrolled in one of these plans, you do not need to take any action. Your coverage will automatically be transferred to New York Life. The rates have also reduced for these particular plans. And in addition to that, if you're enrolled in the specified disease, formerly known as critical illness, or if you enroll during open enrollment, you can earn a $75 credit each year by completing an eligible preventative care screening. And then lastly, bereavement support. New York Life is introducing bereavement support. These are resources through empathy and survivor support. Those are the two programs. And these programs offer compassionate guidance and practical tools for you and your family during times of loss. Everything from emotional support to help you with estate and claims processes. We will discuss this benefit in more detail in an upcoming slide. Next, please. Okay, so the contributions are increasing for your flexible spending accounts, tax savings accounts. The first one is the healthcare flexible spending account. In 2026, you'll be able to contribute up to $3,400. And the rollover is increasing as well from $660 to $680 into 2027. Dependent care flexible spending account, you can now contribute up to $7,500 into your dependent care flexible spending account. And this account is used for babysitting, summer day camps, nursery schools, and preschools, as an example. And then we have transit and parking. The limit for transit and parking has also increased from $315 to $345 to $340, sorry, excuse me. And these funds can help you pay for travel expenses such as parking and transit, or both. If you take a bus and then, drive to the bus, you can use both the transit and uh, the parking. Okay, so now we're going to turn it over to Angela Chen to continue the presentation. Angela?
Thank you, Lucia.
You're
We would now
welcome.
like to shift gears and highlight a new resource that was mentioned before, the Bereavement Support Program. We understand that experiencing a loss is one of life's most difficult moments, and we want to ensure our community feels supported during these times. Starting in 2026, Columbia is adding services from New York Life, including empathy and survivor support, to help employees and their families navigate both the practical and emotional aspects of loss. Both services aim to support beneficiaries after the death of a loved one, offering grief-related guidance and resources, which will be provided at no cost to you. On this slide, you will see key unique highlights for both empathy and survivor support. Empathy is a digital app-based service and offers a self-service model available 24/7, which can be shared with up to 5 friends or family members. This gives users the ability to handle tasks digitally, such as closing accounts or creating an obituary. Continuous support is also available through a real-time chat feature with care managers. This allows you to navigate grief-related tasks at your own pace. Now, for those who prefer hands-on support and guidance, survivor support provides direct contact with a dedicated human specialist. They will assist with complex processes such as funeral planning and insurance claims. Users can tap into community-driven resources, including grief camps for children, and the specialist ensures personalized ongoing support, making the experience ideal for beneficiaries needing tailored assistance. Please note that you will have access to both of these benefits. Next slide, please. So we'll now like to take this time to let you know that we are bringing back the in-person benefit expos and health screenings. Please join us at one of the events that are being held around campus. So Thursday, November 6th at the Medical Center, Wednesday, November 12th at Lenfest, Manhattanville campus, and Thursday, November 13th at Lerner Hall, Morningside campus. You can check your blood pressure, cholesterol, and glucose levels. Fasting is recommended, but not required for these procedures. There will be representatives from Columbia Human Resources, Columbia doctors, as well as benefit vendor partners for you to speak with. At the medical center, there will be ergonomic assessments, acupuncture, upper body massages, and skin cancer screenings. At the Morningside and Manhattanville locations, you can walk in to receive a free flu shot. Next slide, please. So as mentioned, open enrollment will begin on Monday, November 10th, and will end on Friday, November 21st. When making your elections, please remember to check out in cubes to complete your enrollment. Next slide, please. Now, if you have any questions, please submit them through the chat feature. If you cannot stay and have additional questions, please contact the Benefits Service Center at the information on this slide. We encourage you to visit our benefits website where you will find all of the information we have presented today. And again, we thank you for joining today's session. So I will hand it over to Jose, who will be managing the chat, and we are here to answer any questions you may have.
Thank you, Angela and Lucia. We have one question in the chat, and the question is directed to you, Lucia. Is the transit parking 340 per month?
Yes, it is per month.
Okay.
Yes.
Thank you, Lucia. If you have any questions, please enter them in the chat. I have a second question. This is regarding if you retired in 2026, what happens to your FSA contribution?
Yeah.
So, okay.
No, go ahead.
We're fighting for questions here.
Go ahead.
So if you retire in 2026, your contributions, you will have 90 days. Within 90 days, you can submit for reimbursement, but services have to be incurred while you were still an active employee. So for example, if you were to retire June 1st of 2026, the services rendered will be between January 1st and June 1st, or actually May 31st. And you'll have 31 days from June 1st to submit for reimbursement.
Thank you, Angela. If you have any questions, please enter in the chat. Angela, this question is for you. The question is, how do you know what is covered under, to
That
Lauren,
would be for
really,
Lauren, really.
yeah, for critical illness under the New York Life? Would you like me to repeat
Lauren.
the question, Lauren?
Yeah, I was just going to talk. I'll send the link in the chat to where it's okay, where you can find that information. There's a listing of the program and the associated reimbursements.
Thank you, Lauren.
Sure. And
Okay.
someone just posted
Yeah,
about, I
they
see
see it under
what is,
MetLife, yeah,
See what MetLife, but I'm not sure.
and they want to know if it changed to New York Life.
so the question is, I see what is under MetLife, but not sure if it will change with New York Life.
Right.
So currently the accident insurance, the critical illness, which is now called specified disease, and the hospital indemnity plan is with MetLife, and those are changing to New York Life on January 1, 2026. MetLife also manages the legal plan, and that is not changing. So hopefully that helps answer that question.
Thank you, Lauren. Lucia, the next question is for you. What is the minimum monthly transit contribution to maintain an active EVPA card?
The minimum monthly contribution would be $10, so anything between $10 and $325 a month.
Okay. The next question is for you, Angela. The question is, the flexible account information remains the same, and we need to reapply as you stated.
Yes, the flexible spending account, every year you will need to re-enroll. It's a new allocation every year. So if you had an FSA for 2025 and you would like to re-enroll for 2026, you would go into Cubes and enter your enrollment anywhere from $120 to $3,400 next year.
If anyone has any questions, please enter them in the chat.
So Lauren, will the coverage remain the same under New York Life? Even it's just the transfer of vendors, correct? I think someone just had a follow-up question.
It's a transfer of vendors, but in most cases, the coverage is enhanced. It's not the entirely same plan. The rates have reduced. And like I said, in most cases, so on our website, we have both the MetLife and the New York Life information for all three programs.
So they can compare.
Yeah, so you can go out and see what specific plan you were asking about and how the
Mhm.
coverage is enhanced.
And just re-enter the link for everyone in case they didn't see it.
That's the link just to critical illness. Let me send the link for all the voluntary products to everyone.
Thank you, Lauren.
Okay, thanks.
Thank you.
Okay, back to Lucia. We have a transit parking reimbursements are taxi included.
No, they're not included. Unfortunately, no.
We have plenty of time, but we'll hang on for a few more minutes if no one else has any questions. You can always contact us 212-851-7000 or email us at hrbenefits@columbia.edu. During the time of open enrollment, which is November 10th to November 21st, our phone lines will be open from 9 a.m. to 5 p.m. I don't think any more
Okay.
questions are coming in.
There's one here, estate
Oh.
probate part of bereavement
estate.
provide legal services. I'm not sure if it's specific to probate or state. I mean, they help you with they do help you with that. I don't know whether it's probate as well. Um,
I would
I
think that they would direct you, but they would not
yeah, help you
provide a
with that.
lawyer.
Yeah.
The legal plan that we have, which is a payroll deducted legal plan, if you'd like to elect, will certainly cover
Mhm.
something like that. But I would think that the support services are more of a referral type support than actual filing.
Yeah, I believe
Okay.
so. But you can call us and we can definitely look into it for you to give you a complete answer.
Angela, I have another
212-85.
question. The question is, if you do your enrollment on November 10th and then realize you need to make an additional change, can you make that change?
Yes, the open enrollment period is open from November 10th to November 21st. So if you make a change on the 10th and you realize on the 20th, I would like to make a change, it is still, the window is still open for you to make a change.
Thank you, Angela. Another question for you, Angela. Does the dental remain the same?
Yes, there are no changes to our medical or dental or vision plans.
Thank you, Angela. Any other questions? Please enter them in the chat. Angela, I'm not getting any other questions as of right now.
And again, we just want to thank you all for joining today's session. We hope the information is useful and helps you make informative decisions in the upcoming open enrollment. So one last time, our telephone number is 212-851-7000 and our email address hrbenefits@columbia.edu. You can also visit our website listed here, which will have all of the information we have discussed today. So I hope, and yes, I just said the recording will also be posted online. And one last one, can we purchase additional plan or increase our plan with United Healthcare? There is no increase
There
to
is
our plans. We do have 4 plans under United Healthcare. We have a high deductible plan. Oh, I'm sorry,
no
not a high
support.
deductible plan. It's just, we have several different plans for support staff. So depending on what category you're in, you have different plans available to you, but there are no buy-up plans with our plans, unfortunately. Okay.
No.
So again, thank you all for joining and please
Thank
enjoy the
you.
rest of the day. Thank you.
Bye-bye.